Pediatrics, and this particular video I'm just going to cover the congenital heart defects, in particular the mixed defects, and that includes the transposition of the great vessels, the truncus arteriosus, and the hypoplastic left heart syndrome. Although I think for this particular video I'm just going to focus on the transposition of the great vessels. Mixed defects are characterized, basically they're defects that cause the blood to mix, the blood flow to mix, oxygenated and deoxygenated blood mixed. So in order for with the chest X-ray, you'll know pulmonary artery oxygen saturation. Your right ventricular systolic pressure equal to systemic pressure is what something that will show up on your cardiac cath as well. And dye injection reveals transposed vessels and the presence of any other cardiac defects. The medical management of a transposition of the great vessels is prostaglandin E to maintain the patency of the ductus arteriosus, prophylactic antibiotics to prevent bacterial endocarditis, atrial balloon septostomy is done during the cardiac catheterization to enlarge the patent foramen ovale, which provides oxygenation by allowing greater mixing of the pulmonic and systemic systems. And also corrective surgery to redirect blood flow by switching the position of the major blood vessels can also be done. Your nursing interventions, which is what we are concerned with, of course you want to explain the heart defect to the child and the parents, patient teaching, and prepare the child for cardiac catheterization or surgery. You want to monitor vital signs, pulse oximetry, and intake and output to assess renal function and detect changes. You want to assess cardiovascular and respiratory status to detect early signs of decompensation. Monitor fluid status, enforcing fluid restrictions as appropriate, basically to avoid fluid overload. You want to weigh the child daily to prevent fluid overload or deficit. You want to weigh soiled diapers to monitor fluid output. And you want to organize physical care, basically to reduce the child's oxygen demands. Give the child high-calorie foods that are easy to ingest and to digest, and you want to encourage the parents to help their child assume new activity levels and independence. Okay? And basically that's it in the transposition of the great vessels. With truncus arteriosus, you have a failure of the common great vessel to divide into the pulmonary artery and the aorta. So you have one big major vessel or trunk arising from the left and the right ventricles, right? And that causes the blood to be mixed as it's pumped out of the ventricles. So deoxygenated blood from the right ventricle and oxygenated blood from the left ventricle mix and are ejected through the common vessel to the lungs and the systemic circulation. Okay. With hypoplastic left heart syndrome, you have underdevelopment of the left side of the heart, and the defects include aortic valve atresia or stenosis, mitral valve atresia or stenosis, diminutive or absent left ventricle, and a severe hypoplasia of the ascending aorta and aortic arch. So what happens here is the blood from the left atrium travels through the patent foramen ovale to the right ventricle and pulmonary artery, entering the systemic circulation via the ductus arteriosus. The patency of the ductus arteriosus, which allows blood flow to the systemic circulation, is necessary in this instance to sustain life. And of course, your assessment findings, you'd find cyanosis, weak or absent pulses, signs of heart failure such as tachycardia, sweating, cardiomegaly, tachypnea, cyanosis, and peripheral edema. Diagnostic findings, echocardiography provides visualization of the defect. And again, the medications with this would be prostaglandin E to maintain the patency of the ductus arteriosus, the digoxin and diuretics to control heart failure. And surgical repair, you can have heart transplantation. Vital signs, pulse ox, eyes and nose. Assess cardiovascular and respiratory status to detect early signs of decompensation. Monitor fluid status. You want to enforce the fluid restrictions to prevent fluid overload. Take the child's apical pulse for 1 full minute before giving digoxin. You want it greater than 100 beats per minute, 100 or more. Weigh the child daily, weigh soiled diapers to monitor fluid output, and again, organize your physical care so that you decrease the child's oxygen demands. And that is that in a nutshell. I think I covered everything as far as congenital heart defects are concerned. I'm ready to move on to GI